Bismillahirrahmanirrahim. Assalamu alaikum. Today we are going to show the basic physical therapy treatment of scoliosis patients. Right now we have a patient who is suffering from scoliosis, and if you can come closer to show the curvature over here. So this is basically the scoliosis, and this is the concave side. Look at how my hand is going inside, and this is the convex side. So we are going to say that this is the right lumbar scoliosis. There's a bit of rotation, so we can also call it as rotoscoliosis. So the side of rotation is the left side, because this is the reverse of it. So left rotation with right scoliosis. So this is rotoscoliosis, lumbar scoliosis. Now the basic maneuvering that involves passive stretch, and that is very simple because we need to correct it to the neutral or the normal. So this pelvis is rotated in this direction, which is the posterior right, but in reality it is in relation to the trunk, it's left. So what I'm going to do is I'm going to press it down. You can see I'm going to press it in this way. As I'm going to press this in this direction, I need to press the opposite shoulder into the opposite direction. This is really very important for us to understand and remember. We need to maintain the stretch for about 5 to 10 minutes on daily basis, twice daily, and it will bring about a very significant change. So after this you can also place a pillow or cushion onto the convex side. For that purpose I'm going to show you how to perform the exercises on the Swiss ball or the Physio ball. So for this I will request our patient to please come and help us. Thank you very much for a very swift response. So I want to stabilize the ball. Let's say I'm a single person who is going to treat the patient. So the most important thing is that the ball should be stabilized. If the ball is not stabilized, it will move away and your patient may fall. So what I'm going to do, that I want my patient to come back onto this ball and then lean in the backward direction as if I'm doing this. So this is the extension of the spine that I want to go for right now. So for the very same purpose, I will fold my patient's axilla and I make a turn, and because the ball is being stabilized on the back side, now I'll shift my patient onto the ball. Once the patient is shifted, I can remove the blocks, and here you can see I've transferred the patient single-handedly onto the Swiss ball, and this is the basic extension. And with this there is auto traction onto the spinal segments, as well as there is correction of the spine. So in this manner you can rock the patient into forward and backward direction. Similarly onto the right and left direction. Make sure your patient don't fall off the ball. So you can also oscillate the patient onto the ball. That will also create some mobilizing effect, or it will make your patient a bit relaxed. Let your patients get comfortable with the ball and with the surroundings, and you can also support your patient's head if their neck is hurting a bit. So you can also stabilize this, and you may require some assistance for this. So you can go all the way and you can ask them to shift their weight onto their legs like this. So it will also train their leg muscles. The next thing is, I told you that when the patient was in prone position, I told you that it was the right lumbar scoliosis. So for this reason, we are going to turn the patient in the convex direction. So the convex direction is this, right? So we need to rotate to the same side. So right rotation is going to extend. So how I'm going to do is, I'm going to shift my patient. I'll be moving in the opposite direction. I hold my patient and I'll shift my patient in this way, inside sideways or in sideline. Can you please put your hand over here? So the hand is onto the ball or under the ball, and this will also help us. Can you please remove this hand? Yes, in this direction, and this is going to stretch. So ideally we will be requiring a bit more space, but here we can stretch the patient into side bending. So we can also move it in superior and inferior direction, and we can also oscillate. Once done, we can ask the patient to assume the supine position similarly to get comfortable, and after that we can shift the patient to normal physical therapy exercises and other treatments. Thank you very much.